Okay, so next up, I'd like to bring up Jordan Ruch. Jordan is the Chief Innovation Officer for RWJ Barnabas Health. You heard me chatting with Lou earlier. So come on up, Jordan. Let's give it up for Jordan Ruch.
Yeah, thanks a lot. There we go. All right, good morning, everybody. Welcome to day 3. And today I'm going to go through some of our platform that we have at RWJ Barnabas Health. And as I'm going through the presentation, I really want everyone here to think about how many applications there are to integrate voice technology into some of the things we've already done. So I mentioned my name is Jordan. My last name is Ruch, and I'm the Chief Innovation Officer for RWJ Barnabas Health. So I've been with the organization for about 16 years, and I'm here today with my amazing team of developers. A lot of them are here. A lot of the things that you'll see today are things that we've been working on over the last 18 months. So RWJ Barnabas Health is the largest and most comprehensive healthcare system in the state of New Jersey. We cover about 5 million diverse residents across the state, and that's more than half the state's population. So we are also one of the largest private employers in the state, and we see about 750,000 ER visits every year. Here's our map of the state. We have 11 acute care hospitals, 4 children's hospitals, and a whole lot of other stuff going on in the state of New Jersey. So I wanted to talk today about some of the pressures that are specifically focused towards the healthcare market as they relate to voice. And the hospital's in the middle, and that could be a provider office, that could be an acute care hospital. It doesn't really make any difference. But we're constantly faced with forces of change from all sides. Many of the forces are generated from the evolving regulatory world, as well as market conditions and technology innovations like Amazon Alexa. We are, right now, going through a rapid shift to a more consumer-friendly, and the competition around us brings patients to us that have liquid expectations. What I mean by that is the convenience of Uber and the convenience of Amazon Prime. When patients come to the hospital, they expect that same level of service. And at this time, we can't quite provide that convenience. Changing technology has also given us an opportunity. New technologies like HL7 Fire and some of the things that came with meaningful use, now called promoting interoperability, have given us a lot of momentum in the years moving forward. The other influence that's very significant for us is that the millennial cohort is going to exceed the boomers in 2019. That's important because millennials have a lot different view in terms of adoption of technology and their attitude towards electronics. So looking through our strategies for patient engagement, we have mobile technologies like remote patient monitoring, virtual visits, mobile apps, and voice. These are all not only going to help us provide better care, but they're going to help us control the costs of healthcare by providing the right care at the right place. That's not always in the hospital. Sometimes it's at home, sometimes it's in a clinic. So as we evolve through this technology, we're going to be able to provide that care in the right setting. And if you think about how rapidly this space has been changing, I like to use the example of the iPad and how that's changed how we interact with the internet. The iPad didn't exist until 2010. And it's completely revolutionized the way that we interact with the internet. I expect voice to do the same thing, and it's the UI of the future, and we've been talking about it for 3 days. So an interesting statistic is that smartphone penetration in the market, it took about 6 years to get to 75%. Analysts believe that voice is only going to take 3 years to get to 75% market penetration. And 1 in 6 American homes already has a smart device that's powered by a smart speaker in their home. I mentioned millennials, so this research comes from Pew, and they do show that millennials are going to overtake boomers in 2019. And I mentioned it's important because their view on technology is very different, and what they're comfortable doing with the technology is very different. Their sense of openness to the technology is very different. 75% of them look at reviews before they book an appointment with a physician online. Almost the same amount would rather see a doctor virtually than ever go to an office. And 71% would prefer to book an appointment online with a mobile app instead of be tortured on the phone. And we agree, and we want to provide that technology for our patients in New Jersey. And I'm going to show it to you today. That's what we're going to do about it. So this is our framework for innovation for RWJ-Barnabas Health. I'm not going to have time to go through all of these today, but I will touch on a few. So the core strategy for our engagement with patients is our RWJ-Barnabas Health Connect app. We'd like that to be the center of the patient's mobile universe. We offer appointment scheduling directly into our practices and into our hospitals. And we also offer the common features like directions, and it's linked to our social media. Moving around the top of the circle, the next thing I'll talk about today is text-based engagement. This is an area where we've been doing a lot of investment over the last year, and we're going to continue rolling it out at all of our facilities through the end of this year. By the end of this year, we'll have it live across every RWJ-Barnabas facility. The other one I'm going to touch on is remote patient monitoring. So these are kits that are in the patient's home that remind the patient to take their medications. You can do a virtual visit through the device. We've seen some amazing traction in that space. And the overlap between a device like that and what we could do at the next level with voice is truly amazing. I'm not going to have time to talk about the broker, but the broker is really what gives our applications the ability to pull available appointments out of the hospital and out of the practices and show them to potential patients, whether that's on our website or whether that's within Health Connect, our app. So the first thing I'll go through is our app. So at a very high level, the uppermost search bar is what's most applicable to voice. It's our elastic search. So here, a potential patient could use any set of keywords, and we're going to try to direct them to exactly what they're looking for. They could be searching for a cardiologist in Livingston. They could be trying to get lab results out of one of our hospitals in New Brunswick. Or they could be trying to schedule an EEG or a mammogram. All of those things can be done from the app. I'm going to go into a little bit more detail on appointment scheduling, but we'll skip over that for now. There's a physician directory. There's directions and locations for all of our facilities. It geolocates the patient based on their device, and it'll show you the closest facilities in that area. We also have direct access to the patient portals that nobody uses. So there's a huge opportunity here to make it a lot more convenient for a patient to actually utilize the information that's in a portal. So if I had clicked on the appointments button from the app, I'd be brought to this screen. And this is where we're interrogating the patient to learn if they're trying to schedule a hospital diagnostic appointment, like a EKG, or a physician office appointment. And depending on the pathway they choose, we have integrations into our central scheduling platform and into the practice management systems in the provider's offices. So if I picked that I wanted to schedule a provider appointment, I'd be brought to this screen. So it's going to show all available appointments in a list sorted by location closest to me. I can search by specialty. If I have a physician I'm looking for, I can search them by name. Once I've selected the physician I'd like, we're going to pull the information real time out of that physician's practice management system and show all of the available appointments for that physician. When a potential patient clicks on the time slot that's most convenient for them, we now give them the opportunity to take a picture of their insurance card and any insurance or any provider scripts that they may have associated with it. If the patient elects to take a snapshot of their insurance, we don't require them to enter any information. We'll pull it all right from the application. And that's it. So thinking about Health Connect, I wanted to talk about some of the opportunities using voice with that same technology. Off the top of my head, I could probably think of 20 skills that would apply to just appointment scheduling. But at a very high level, it makes a lot of sense that technologies like Alexa are going to have visibility to a patient's personal calendar. They're going to know when that patient's available. Using Health Connect, Alexa could also know when the provider is available, and which providers are accepted by that patient's insurance, and which providers of a given specialty are closest to that patient. We could provide all of that through a voice experience. The other use case that the team's been talking about is ED wait times. So in an emergent situation and you need something quick, something that's fast from brain to action, voice is the perfect thing for that. You're not going to a website, you're not downloading an app. All you need to do is ask. The next thing I'll talk about is our telehealth platform. So we've partnered with American Well, and we offer telehealth visits from smart devices or from a computer. As of a couple days ago, we've had about 3,500 users enroll in that service. By the end of September, we'll have a full public-facing offering that any member of the state of New Jersey or abroad could use to tap into board-certified physicians. Currently, we're working on a program around urgent care, and we're working with a number of our specialists in the hospital to stand up specialist referral appointments through the same technology. The next thing I'm going to go through is remote patient monitoring. So with this system, we found that apps sometimes are not quite simple enough for some complex and elderly patients. So we actually provisioned and set up a tablet and in that package comes a tablet, a Bluetooth scale, a blood pressure cuff, a pulse oximeter, and the tablet's preloaded with the medication information and reminds the patients to take their medications on time. It also gives the patient quick surveys on their care plan, so it's set up specifically for a heart failure patient or a COPD patient. And we ask them very specific questions, and the answers to those questions and the observations from the scales and the blood pressure cuffs are sent to our care team, and they're being monitored 24/7. These are some of the types of peripherals that can connect to the device. The next thing I'm going to talk about is our MCRM platform. This is basically a text messaging platform that we use to communicate with our patients when they're with us as an inpatient and after they're discharged. We also use it as a service to do appointment reminders for any ambulatory appointments, and we keep in touch with the patient after they're discharged from the hospital to try to keep them engaged. So the first thing that a patient would get would be a welcome message. So real time, upon registration, we're listening to those registration messages, and we'll send the patient a welcome message. And the point of the welcome message is really to just introduce them to the service and let them read what we call the 5-star tips. So we want patients to make sure they ask us any questions that they have about their care. We want to make sure that they understand their medication education. So we say that right up front. So if a patient is an inpatient, every day they're in one of our facilities, they're going to get a daily message. That daily message comes either at noon or at 2 o'clock, and it has a brief survey on patient experience, and we use that as triggers to do service recovery. So if we have a patient who's not satisfied with the condition of their room, environmental service is getting notified immediately so we can resolve the issue. We also ask if the patient understands their plan of care, if they've visited with their care team, and if they have any complaints about the condition of their room. We also give patients the opportunity to recognize the staff at the hospital, and we use that as a way to recognize all the wonderful work that happens inside the hospital walls. One of the most exciting features of this platform, we've interfaced it with our EMRs, and we're collecting all the medication administration messages that happen in the EMR. And every day, as part of that daily message, we're packaging up all of the medication education, and we're sending it to the patient. So they know what to talk about with their care team, they know what the potential side effects are, and throughout the visit, they're going to receive that medication education message as new medications are administered or discontinued. There's also a helpful tip section. This allows the patient to see the common questions. What are the visitor hours? What's the cafeteria menu? How do you get on Wi-Fi? How do we get into the patient portal? Those types of things. So after discharge, we put the patient into categories based on why they came to visit us. There's a standard discharge, and those patients get questions about making sure their follow-up appointments are scheduled, making sure they understand their discharge instructions. And then on the right side, you can see there's additional care plans that are specific to a patient's condition. So for a heart failure patient, we're asking them if they're weighing themselves daily. And we're asking them if they've gained any weight overnight. If there's any clinicians, they probably know why that's important. They told us that if a CHF patient starts to gain weight overnight, it's an indicator that that patient may be readmitted. So we monitor that with this survey, and we can do outreach to the patient. We're alerted when that question is answered in that way. And care plan by care plan, there's specific questions depending on the patient's condition. The other thing that we're able to provide is a visit summary. So after the patient's visit with us in an office or in one of the hospitals, we can actually send visit summaries directly to the patient's phone. So this will contain medication information about the medications the patients were discharged with, as well as education and videos about the conditions that were identified during the stay. So I went through remote patient monitoring. I went through Care Notify, which is our text messaging platform. And I want to talk a little bit about overlap between those technologies and where we could take it with voice. So many of the existing data sets could be delivered in a patient room during a visit. So imagine a smart speaker in the room that could tell the patient what the plan of care is for the day. It could tell the patient what their medication education is for the day. The patient could order meals, they could order room service, they could control the lights and the temperature in the room, similar things to what you can already do at home. There's also a big opportunity to replace the nurse call systems. So in healthcare, a lot of nurse call systems are still powered by serial cable. There's a huge opportunity for disruption in nurse call, and I think that there are enormous utility with a smart speaker to help be aware of the condition of the room and the condition of the patient. We can respond real time to what's happening in the room. So those are some of the things we could do during a patient's visit, but there's a whole nother set of things we could do after the patient goes home. A lot of those things we're trying to deliver through the patient portals, we're trying to deliver them through Health Connect, we're trying to deliver them through the text messaging platform, but there's a population of patients who we're not able to reach. It would be amazing if we could give patients appointment reminders in their home through their smart speaker. We know the follow-up appointments that need to get scheduled. We know if the appointments have already been scheduled, and we can help remind the patient of those appointments that are coming up or assist the patient in making those appointments that are needed. We could also give patients at home medication reminders. So when the patient leaves one of our facilities, there's a clear schedule of medications that that patient should be taking or a clear indication of medications that that patient should stop taking. The problem is we send patients home with a packet, and we're not calling out the stuff that's really important that the patient takes attention to. And the medication adherence and keeping with the care plan are two things that we could distill from that documentation and put directly in a patient's home. We could also do care plan questions, similar to what I talked about with the text messaging application. Using some of the ambulation features that are coming and some of the sensory technology that's going to be incorporated into the smart speakers, we can know if a patient's ambulating. We can know if a patient is taken their medications. They could verbally confirm that they've taken their medication. We could also include notifications to family members. So another one of the keys to keeping a patient healthy is making sure that they have support. A lot of times that support is going to come from family members or friends, and a lot of times they're left out of the process. Using this technology, we'd be able to notify friends and family members if we notice something that is going off track. The family and friends is really the framework that can keep our patients healthy. And the last thing I'd like to talk about are voice opportunities for providers. So I've talked a lot about voice opportunities that are patient-facing. There's an enormous utility around the provider space as well. So the first two things I'll mention are threats. So there is a lack of a full medical terminology support with this technology right now, and that's a barrier that we'd have to overcome. When a physician or when a care team member starts to speak highly clinically, the devices at this point aren't going to recognize that terminology. There's work underway that's going to resolve that, but it is a threat to success in healthcare. The second one I was going to mention, Aaron stole my thunder, but the platform as of now is not yet HIPAA compliant. And that's important because in order to protect patients' privacy, we need to make sure that that minimum necessary bar is met. And essentially, all it means is we need to work with Amazon on their business associates agreement and make sure it's amenable to healthcare. So those are some of the threats to success. And I'm going to talk now about some of the opportunities for providers. So it's really all about minimizing the time from brain to action. In the hospital, we desperately need a way to reduce burden on providers. So I've worked with EMRs and EMR development for most of my professional career, and there's a lot of opportunity for improvement. There's too many providers that are forced to spend a majority of their time looking at computers rather than looking at patients. There are a lot of skills that are being developed now that could help a physician have a natural conversation with a patient and automatically complete the required documentation in the EMR. So there's a document that's created at most healthcare institutions called a health history. It really could be a conversation between a provider and a patient. And using speech recognition, we could do all that documentation, get the provider out from behind the screen, and get them back at the bedside. I believe we should use this technology to focus on what matters most. Thank you all for attending the Voice Summit today. And let's do something great and bring the providers back to the bedside. Thank you very much.